Hello, everyone. My name is Zachary Brooks from UGenome. We make genomic medicine personal and accessible for everyone. I'm really excited today to be able to have a conversation with Dr. Jaden Lee, who's the Chief Genomics Officer for UGenome. All right, so the first question, Jaden, is pretty basic. What is pharmacogenomics for the average person who doesn't know about it, has never heard this term before?
So pharmacogenomics is really utilizing the information from your genetic makeup to guide your pharmaceutical care. So it is really to look into your genetic makeup and how that may affect your reaction to drug, and how your body may metabolize the drug. And that will potentially help us to choose the medication that works best for you with minimal side effect. So it's really another tool. We certainly use lots of informations when we try to pick a drug for our patients, and genetic information is just another tool that will help our providers to choose the best medication for our patients. There are lots of drug gene interactions that really needs to be addressed, and the information on that will certainly help you with choosing the right medication. So really, it's focusing on your genetic differences and how that will guide your therapy.
So, it sounds a little bit like data science that more people are kind of familiar with. Is it something like data science?
I will say it's not strictly data science, but it's a combination of, I would say, data science, biology, and clinical care. So it is really understanding the biology of human and how the genetic can affect it. Data science is more to do with how we actually dissect and analyze these information together, because this is a lot of information. And we want to also bring in the clinical component where how it can actually be implemented and used in actual clinical care, which is also important. Implementation is always a challenging in healthcare system, so that is definitely another important aspect.
Okay, so one of the things you mentioned earlier about pharmacogenomics is that the starting point is response to medications there. So do people respond to medications similarly or differently?
So typically, there's a good chunk of patients who will respond well with minimal side effect. But always, if we are thinking about a bell curve, people on the each end of it, they just may not respond the same way. They could have more side effects. They might not, the medication might not work at all. So people do respond differently, and we think that genetics play a role in that difference.
Great, thank you so much.